Introduce myself. I'm Lauren Divendarfer, and I'm the medical educator for the DIS Foundation. Just a little about me. I'm a full-time student at Indiana University, and I am also a AHA certified BLS and CPR instructor. Today, we're just going to learn how to perform CPR, how to use an AED, and how to help relieve someone from choking. And then I believe at the end of this presentation, you guys will have a chance to ask me questions. So just a little bit of who we are at the DIS Foundation. Maxwell was an infant that was delivered by an emergency C-section 1 week after the 2010 earthquake in Haiti. Moments after the delivery, the top picture was taken by a nurse who was untrained in recognizing Maxwell's need for basic life support. And luckily there was someone else around, and upon showing the photo to a BLS trained healthcare provider, life support was given to Maxwell and ended up saving his life. And you can see in the bottom picture, he is no longer blue and healthy. And so basically we just saw that there was this big gap in people not knowing how to perform CPR. And so that's why we've made it our mission to go out and teach as many people as possible, so that in the case of cardiac emergency, more people are prepared to intervene and help someone out. So why learn CPR? 70% of Americans feel helpless to act during a cardiac emergency. And this is either often because they don't know how to administer CPR, or it's just been a long time since they were last trained in CPR. In the US, there are more than 350,000 out-of-hospital cardiac arrests each year. 70% of these cases happen in homes where it's less likely that there's someone who is CPR certified to be around. Almost 90% of people who suffer out-of-hospital cardiac arrest die. And again, this is just because people don't know how to intervene and help. Only 46% of individuals who experience an out-of-hospital cardiac arrest get the immediate help that they need. However, CPR is a great thing to learn because immediate CPR can double or triple a victim's chance of surviving. Now, common fears as to why people don't perform CPR in cardiac emergencies. Sometimes they're scared of disease. This is the whole mouth-to-mouth idea. However, there's barrier devices available, such as a pocket mask, which once you're certified, if you want to go out and get one and keep one on you, you can. And there's also bag mask devices used in healthcare settings. But basically, these just prevent you from having to directly put your mouth on the victim's mouth. There's also hands-only CPR, which is compression-only CPR. And this can be used for teenagers and older who you've witnessed suddenly collapse in an out-of-hospital setting. But they do not recommend using this for children and infants. And this is just because oftentimes children and infants go into cardiac arrest because they've already been having respiratory issues for some time that led to that. And so they've not been getting oxygen for a while. And so those breaths are much more important for children and infants. Another common fear is liability. People are scared that if the victim does not end up surviving, that somehow their death falls onto them. However, the Good Samaritan Act prevents anyone, a rescuer, from being held responsible for the death of a victim. The fear of being unsure of your skills or that you might hurt or kill the patient kind of go hand in hand. It's better to do nothing, or it's better to do something than nothing at all, because a victim is dying. In this case, their heart isn't working. And so you can really only benefit the situation from there. You can't really do more harm. And then in the case of an unsafe scene, this is the only time when you as a rescuer should not perform CPR, because you want to be aware of your surroundings so that you don't become a victim yourself. So what even is CPR? CPR stands for cardiopulmonary resuscitation. The cardio refers to the heart, pulmonary refers to the lung, and resuscitation means to recover. CPR combines rescue breathing and chest compressions, and this supports heart and lung function when it appears to be inadequate. And thus, you're providing oxygen to the brain and all other important organs until further help arrives. So I've been saying it's very important to start CPR immediately because it increases the likelihood of survival. Brain damage can start within 4 to 6 minutes after the onset of cardiac arrest and is almost certain after 10 minutes without effective CPR. So here's just a quick overview of how to perform CPR. First, again, you want to ensure a safe scene. You don't want to become a victim yourself. Second, you would want to assess the victim for responsiveness. Give them a quick tap, shout, "Hey, are you okay?" Basically, what you would want to do is how you try to wake someone up if they were sleeping. Then you would want to go ahead and call 911 and get an AED if they're unresponsive. If someone else normally, then you would just want to, and they're unconscious, just stay with them, still call 911, and just make sure you're monitoring their condition. If they are unconscious and not breathing normally, then you'd want to go ahead and begin CPR, starting with 30 chest compressions. After those 30 chest compressions, you'd want to open the airway using the head tilt chin lift maneuver or the jaw thrust method, which I'll go over later, and then deliver 2 rescue breaths. And you just continue CPR at a ratio of 30 chest compressions to 2 breaths until help arrives. Once an AED is brought to scene, you should set it up and just continue performing CPR and use. When performing chest compressions, you want to make sure that you're placing your hand on the breastbone in the center of the chest, and you want to go at a rate of 100 to 120 compressions per minute. You should compress at a depth of at least 1/3 the chest. So for adults, this is at least 2 inches. For children, it's about 2 inches. And for infants, it's about 1.5 inches. You want to allow for complete chest recoil in between each compression. So this just means to make sure you're allowing for the chest to completely rise back up before pressing back down. And this is just so you're getting the most blood output per every pump as possible. You also want to make sure the victim is lying on a firm, flat surface. So if they're in a bed, probably not the best place to perform CPR, just because every time you compress down, their body's going to give into the bed and the chest compression just isn't going to be as effective. So if they're in a bed, if you have a board, you can try sliding the board under them or move them to the floor. And then also you want to minimize interruptions and CPR to 10 seconds. And this is just because chest compressions are the most important part of CPR, and you just want to make sure that that's your main focus. Now, to deliver rescue breaths, there's 2 methods for opening the airway. There's the head tilt chin lift maneuver, and then there's also the jaw thrust. The jaw thrust method is recommended if you suspect that the victim underwent some type of trauma, and this is just because it's less likely to further a spinal or head injury. When giving the breath, you want to make sure you're creating a tight seal with your mouth, pocket mask, bag mask, whatever you're using to deliver the breath. And this is just so that the air is going into the victim's body and not elsewhere out into the atmosphere. Then deliver 2 breaths. You just want to blow in for 1 second. And then when you deliver the breath, watch for chest rise. And this is just to verify that you did correctly give the victim a breath. If you don't see chest rise, you can try putting the airway back to normal and then reopening it again. But you don't want to spend longer than 10 seconds trying to give an effective breath. So if you can't give 2 effective breaths in 10 seconds, then just resume chest compressions. You also want to try to avoid overventilation. That's just why they say to blow for 1 second. An AED is an automated external defibrillator. What it does is when you're in cardiac arrest, it's not that your heart isn't necessarily not beating, it's just not beating in an effective way to get your blood pumping through your body. And the AED will assess that rhythm, and if it's a shockable rhythm, it will deliver a shock, and that shock will just reset the rhythm so the heart can start beating normally again. They're very easy to use. I don't want anyone to be scared of them. First, you just turn the device on. If the victim has clothes on, you would want to take them off to expose the chest. Apply the pads, and you can see in the picture, the pads, there's pictures on the pads that show you exactly where to place them on the victim's chest. After applying the pads, you want to go ahead and plug in the connector, and then the AED will begin to analyze the rhythm. When this is occurring, you want to make sure that no one is touching the victim so that they're reading the victim's heart rate and not yours. And then it will either tell you shock advised. If the shock is advised, it will say charging, and then it will prompt you to deliver the shock. If that happens, hit the shock button and deliver the shock. If a shock is not advised, it will tell you shock not advised, resume CPR. And so you just go back to CPR beginning with chest compressions. After the shock has been delivered, if a shock is advised and you hit the shock button, then you'd want to go ahead and continue performing CPR starting with compressions again. And you just leave the pads on the victim's chest, and it will reassess the rhythm about every 2 minutes. There's special conditions that you have to consider when using an AED. for example, pacemakers. And so if someone has a pacemaker, you'll see a little incision mark and a bump in their chest. It's still safe to use an AED on someone with a pacemaker or defibrillator, but you don't want to place the AED pads directly over that. So just make sure that the pads are not over the pacemaker. You also obviously don't want to use the AED when someone is in water. So if someone's in a pool or something, you'd want to first take them out of the pool, dry off their chest before applying the AED pads. If it's a puddle or snow, it should be okay. And then also, sometimes if someone has an excessively hairy chest, you might have difficulty sticking the pads. If there's an extra set of pads, you can try placing the pads on the chest and then ripping it off to remove some hair. But in the situation, just try to do the best you can. And if you can't get the pads to stick for the AED to successfully be able to assess the rhythm, then just resume CPR. Also, in the case of infants and smaller children, you never want two AED pads to directly be touching each other. So if the chest is too small of a surface area, you may need to place a pad, one on the front of the victim and then one on their back. For choking, for adults and children to relieve someone when they're still conscious, you would perform abdominal thrust, which is the Heimlich maneuver, but we just don't call it the Heimlich maneuver anymore. To do this, you would stand behind the victim and wrap your arms around their waist under the rib cage. Put your fist above the person's belly button in the middle of the belly under the rib cage. And with your other hand, hold the fist and press forcefully into the abdomen and up towards their chest. For infants, you would perform back slaps and chest thrusts. So chest thrust is what you do during CPR. And when you're doing this, you want to hold the infant in your lap and put the infant face down on the head, lower than the chest, with the infant resting on your forearm, and then put your forearm on your thigh. And you're going to support the infant's head and neck with your hand. And then you're going to deliver 5 back slaps like you're burping the baby between the infant's shoulder blade with the heel of your hand. And then turn the infant face up and use 2 fingers to deliver 5 chest thrusts, which is just chest compressions. And you just repeat this process until the obstruction has been removed from the airway. If at any time, whether it be an adult, children, or infant, the victim becomes unconscious, you would want to help lower them to the ground and begin CPR immediately. Again, I'm just going to mention hands-only CPR. This can be used for rescuers who've seen a teenager or adult suddenly collapse in a hospital setting and don't feel comfortable giving breaths. However, I just want to reiterate the fact that if it's a child or infant, you should deliver breaths because they have already been having respiratory distress for some time and their body does not have adequate oxygen. So let's just review everything before I go ahead and show you some skills videos. So for chest compressions, you want to deliver 30 chest compressions at a rate of 100 to 100 compressions per minute. If you're wondering what that rate is like, if you know the song Staying Alive, it's to the beat of that song, so you can sing that in your head if that helps you. When compressing, you want to compress at a depth of at least 1/3 the chest. For adults, this is at least 2 inches. For children, it's about 2 inches. And for infants, it's about 1.5 inches. And you want to make sure the victim's lying on a firm, flat surface. In between each compression, make sure you're allowing for complete chest recoil, and you want to minimize interruptions to 10 seconds. When delivering rescue breaths, you want to first open the airway using one of the 2 methods, the head tilt chin lift maneuver or the jaw thrust. Again, the jaw thrust is what's recommended if you suspect the victim underwent some type of trauma. You then want to create a tight seal and deliver the breath over 1 second, watching for chest rise, but you don't want to spend no longer than 10 seconds trying to give that breath. And again, when delivering rescue breaths, feel free to use barrier devices such as a pocket mask. When using the AED, first step is to power it on, remove clothing, and attach the pads. Plug in the connector, and from there, follow prompts. The AED will speak to you and tell you exactly what to do. And then for choking, for adults and children, you perform abdominal thrusts when they're conscious. And then for infants, you perform 5 back slaps and 5 chest thrusts when they're conscious. But if at any time the victim becomes unresponsive, then you'd want to go ahead and start CPR. So now I'm going to show you a skill video. This is performing CPR on an adult and also using the AED.
If the scene is safe, approach the victim and assess their responsiveness. Send another person to call 911 and get an AED if possible. If the victim is not breathing or only gasping, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per each lasting 1 second, and watch for chest rise. Resume compression. It is important to minimize interruptions in chest compressions to 10 seconds. When the AED is brought to scene, begin by turning the device on. Remove any clothing from the victim and apply the AED pads, one below the right collarbone and the other to the side of the left nipple below the armpit. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR beginning with chest compressions. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. Open the airway and deliver 2 breaths. Continue at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives. If the scene is safe, approach the victim and assess their responsiveness. Send another person to call 911 and get an AED if possible. If the infant is not breathing or only gasping, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 of the chest. When the AED is brought to scene, begin by turning the device on. Remove any clothing from the victim and apply the AED pads, one on the front of the infant's chest and one on the infant's back. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR beginning with chest compressions. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. Open the airway and deliver 2 breaths, each lasting 1 second. Watch for chest rise. Begin again with 30 chest compressions and continue at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives. Let the choking victim know you're going to help them. Wrap your arms around the victim and make a fist with one hand and place it above the navel in the middle of the belly. Hold a fist with your other hand and press forcefully into the person's abdomen and up toward the chest. Continue performing abdominal thrusts until the obstruction is removed or the victim becomes unconscious. If the victim becomes unconscious, lower them to the ground and begin CPR. If an infant is conscious but choking, deliver 5 chest thrusts using the 2-finger technique, resting the infant against your forearm and thigh. Turn the infant over and deliver 5 back slaps. Continue alternating 5 chest thrusts and 5 back slaps until the airway obstruction has been removed. Make sure to support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes unconscious at any time, begin CPR.